Good afternoon, everyone. Welcome to the new session of Prime webinars. It is a series of continuation of community education. Today, we have chosen a very special topic. We've got some very good experts. This is pure community based, and this topic, which is right now a very important topic of discussion amongst families, in schools, in the news, amongst healthcare professionals. Uh, November 17th, we are celebrating our World Antibiotic Awareness Program. Basically, we are trying to create awareness where we will tell all of you, all the viewers, on how important antibiotics are, and not every fever is antibiotics. I will leave that to my experts. I have a panel of experts with me today. Without further ado, I would like to first introduce our behind the scene a person who has supported us. Let me thank her to start with thanking her. Uh, During the pandemic, she was upfront. She was part of a very important committee, and she had given us a lot of support, back support with the clinical diagnostics. We present to you our group microbiologist. She's a specialist clinical microbiologist, and she's the chair of our antibiotic stewardship program. Dr. Kavita Didi is with us. Hi, Dr. Kavita. Welcome on board.
Hello to everyone.
Thank you. Moving on, we have our co-chair of our antibiotic stewardship program, co-chair, the committee co-chair. She's a specialist gynecologist, vast experience with her profession. People are very fond of her. She's an expert. She has a lot of years of experience. She is with us for a while. She sits in the Mizar branch as well as the Berjman branch. I would like to welcome Dr. Mary Zakaria on board.
Hello, I'm here, Dr.
Welcome, Dr. Mary Zakaria. Thank you for joining us on this program. Moving forward, the society is incomplete without children, and for that reason, we had invited one of our very he's an expert pediatrician who's been working with Prime. He's also a part of the antibiotic stewardship program. He's the physician who's in charge of his domain. He sits in Motor City, and he's been part of our committee as well. Welcome, Dr. Tanmay Radhakrishna.
Thank you, and welcome and hi to everyone.
Welcome, Doc. Last but not the least, this is a very important person of this group. We have our very favorite Dr. Sameh Al Sayed, who is the internal medicine specialist with us. He sits at 06 Mall. He's also a very active member of this antibiotic stewardship program, and we are very happy to have him to give his info, to give us his feedback, and he will educate us today regarding community infections and from the internal medicine point of view. So let me begin now with my first question, or to Dr. Kavita. Dr. Kavita, can you, for a layman or for all the people who have joined us today, what is the importance of this antibiotics stewardship program, and what is antibiotics and why is it so important?
Yeah, actually, antibiotics are the chemical compounds which kills the bacteria. So, in the last few years, it has been seen globally that resistance for the antimicrobials is increasing rampantly. So, if we don't take action right now, so then we will not left with the many antibiotics, because unfortunately, in the research pipeline, if you see, we are having very few antibiotics in development. So if the antibiotic resistant develops to all the antibiotics, we will not left with any antibiotic to be given, because it's a fight of survival. Fight of survival means the bacteria wants to survive. So whenever we will expose the bacteria to any antibiotic, they will try to mutate or change themselves in a way that they should not be killed by the antibiotics. So if we continue to give antibiotic, they will change themselves. And how? So if we give the antibiotics when it is not required, that is the most dangerous thing. So for that, we run an awareness program, and this program is also for that purpose, to educate the community that antibiotics should be taken as per doctor's advice whenever it is required. These are the not vitamins that we can take it regularly. So that's why we have planned this program. And that's why it is important for community to know also why antibiotics should be taken judiciously.
Thank you. Dr. Mary, my question to you, this awareness among patients, how can it help? What is the expectation from the layman that we created this awareness today? So how will it help to deal with this resistance, Dr. Mary?
The thing is, antibiotics are here for us and they are very useful because when we are faced with certain situations, with infections, then these antibiotics do come in very useful for us. However, judicious use of these antibiotics is very important, and we need to be very careful that we take the antibiotic when it is required, one, and you take it in the right dose, the right time it is prescribed. We don't give up in the middle, and prevent an antibiotic resistance so that the patient can get better, and also the antibiotic resistance is not developed, and the future community would be blessed in the future. Now, since I'm a gynecologist, let me just look a little bit about in terms of gynecology, where we deal with a lot of pregnant women. Now, in pregnant women, we prefer not to give antibiotics because there is a special consideration here because we have a mother and a child involved in the situation, and especially during the whole of pregnancy, especially the first trimester, we are very careful that we prevent any usage of antibiotic because it can cause trouble for the developing fetus in terms of congenital anomalies or any other complication that may arise, because this is the time when the formation of the baby is taking place. The second and the third trimesters are still better off, but the first trimester is little critical. So we have to be a little judicious about our use of antibiotics so that they can be used correctly at the correct time with the correct dosage that will give us the optimal effect.
Right, right. Before I move for my next question, I would like to inform all the viewers that we have some winners. We had a marketing campaign where we had some competitions regarding antibiotic stewardship program and use of antibiotics. And there's a lot of children, they've sent in their entries, some beautiful artwork, some beautiful compilation of videos. So I will be announcing the videos as we go. So please stay tuned for that part. Now coming to Dr. Tanmay. Dr. Tanmay, my question to you, Dr. Mary keeps on saying the judicious use or the judicial use or being careful. Now, does that also apply to the parents as you are a pediatrician? Have you seen this in your practice? A lot of parents walking into your clinic and demanding antibiotics, or they come with a mindset that they believe that until and unless an antibiotic is not prescribed, my child would not get better. So, what is your take on this, doc?
Yeah. I think the overwhelming majority of infections that we see in pediatric practice is basically respiratory infections. Respiratory and gastrointestinal infections make up for more than 90% of the infections that we see in pediatric practice. And we see two distinct groups of parents here. The one, as the group that you mentioned, is they feel that they have a mindset that unless you give an antibiotic, my child is not going to improve. And at the absolutely other end of the spectrum, you have parents who are totally anti-antibiotic. They feel that antibiotics is equivalent to poisons. So let's put this into perspective. See, antibiotics are basically double-edged swords. They are very useful. They are life-saving in many situations, and they can prevent a lot of complications of which can result as a result of untreated infections or incompletely treated infections. A very important and a very prime example being rheumatic fever or rheumatic heart disease, which can be prevented by treating streptococcal throat infections in time with the appropriate antibiotic. And but the other thing is that antibiotics are molecules, as Dr. Kavita said, which cannot really differentiate between the good germs and the bad germs. So what do I mean by good germs? We have a whole population of bacteria on many surfaces of our body, but the most important group is within our digestive system or the gastrointestinal tract. And this is what constitutes what is called the microbiome, along with the bacteria, friendly bacteria, which are there inside our respiratory tract as well as on our skin. And these are responsible for maintaining our immunity. Now, when we give antibiotics, the antibiotics cannot differentiate between the two, and there is a very high possibility that even the gut friendly germs are killed along with the harmful germs which are causing the infection. So we often supplement an antibiotic treatment or follow an antibiotic treatment with probiotic therapy to circumvent this complication of the use of antibiotics. And the second thing, as Dr. Mary pointed out and as Dr. Kavita pointed out, is the development of antibiotic resistance with the indiscriminate use or the inappropriate use or incomplete use of antibiotics. So, if all these factors need to be kept in mind by the doctor when he or she decides whether to give an antibiotic in a given situation or not. I think more than being trigger happy with antibiotics, the important thing is to make a diagnosis. So if we find obvious signs of infection, of a bacterial infection in a child, then most certainly we would give an antibiotic, even basically only on clinical grounds, without doing any lab tests. But there are some children who present with just fever and absolutely nothing else, no localizing symptoms inside at all. And in this case, it depends upon how sick the child is. If the child is very sick, if the child is very young, then we might advise some blood tests or some other tests to see, or maybe some swab tests to see if there is any bacterial infection, and then take action on it as soon as possible. But having set aside those exceptions, in the most of the children, especially the older children and in healthy children, one can wait for a couple of days and observe and re-examine
Great.
and re-evaluate and then decide on a course of antibiotic therapy. So
Right.
antibiotic
Right.
therapy is useful, but they should be used judiciously.
Absolutely, absolutely. Now, moving to Dr. Sameh. Now, this is again a very important person. Dr. Sameh, you are a community-based physician. So basically, you are an internist. A lot of people will come to you. Most common complaint again would be fever, feeling unwell. As a physician, Dr. Sameh, how would you differentiate between a viral infection versus a bacterial infection? And when would you decide to start antibiotics, Dr. Sameh?
First of all, I would like to express my thanks for Prime and for organizers for giving me this chance to talk to the public and my colleagues and to share medical experience here. Second, regarding your question, first of all, this is even my personal practice, especially in adults. Uh, I never prescribe antibiotic without doing urgent blood test, including complete blood count and C-reactive protein as test for inflammatory markers, how severe is the inflammation, because it gives me hint that if this is a bacterial or viral, to avoid any abuse of antibiotic or misuse. And at the same time, it will give me hint about the severity of the infection. This is first of all. Second, according to the system in our body involved, you can get a hint of what type of infection he have. For example, if you have burning urination, this place is most likely bacterial, rarely to be viral. But if he came with respiratory symptoms like coughing, sneezing, especially in the flu time or winter season or autumn season, at that time I will be very cautious in prescription of any antibiotic due to the usual habit that in this time of year we have a lot of viral infection affecting the respiratory system. So usually I advise the patient to do an urgent blood test, and we have in our medical facility to do this test within 15 to 20 minutes. So I will get conclusion, rapid and safe, and to give me a big hint what we are dealing with, and accordingly, I will convince the patient that taking antibiotic would never give him extra benefit. Because if I told him verbally without physical evidence, the communication with the patient here would not be of great value, and he will not be convinced. The most important here is to convince the patient to avoid taking the antibiotic by any other means. He can go to any other physician who is not following, for example, the medical guidelines, and he's under the pressure of some patient, he prescribed the antibiotic. And this is actually what brought what Dr. Kavita denoted in the start, the antibiotic resistance. So I prepare, especially in my adult population, to know where is the system affected in our body, what is the time, what is the patient profile. Is patient elderly, having many diseases, or he's young, healthy, he can have some time to wait for the blood test or not? Is he clinically or vitally stable or not? So it's not a once يعني easy rapid decision. No, I give it based on patient profile, patient medical history, the presentation of the patient itself and how severe, and urgent rapid, two simple blood tests will not take any time. And at the same time, for me, it will give me a great idea about what shall I do and what coverage I need to treat that specific infection. Because every part in our body have a specific bacteria or viruses affected by it, and at the same time, every bacteria have a specific antibiotic. Lastly, usually I take what we call it culture of, for example, if patient came with cough or phlegm or something like this, usually before I start antibiotic, I take the culture of the phlegm or the urine or the stool, whatever he have in his system, to guide me later. If he didn't respond well to that antibiotic, at least I have a map, roadmap. What shall I hit next? That's maybe
Great.
would be my
Thank you. No, I'm very happy that we have a very prime healthcare group has ethical doctors who rely more on evidence-based medicine rather than blindly giving medications. And Dr. Same, you've been one of them, and this is very important for us, for the patients to know as well. Moving forward, I just want to announce a quick announcement for the first group of winners of the video competition. This was between the age of 5 and 10 years old. The videos were amazing. The content was very creative. And we received, unfortunately, it was so many winners that finally we had to work our way up, and we got two first prize winners, and then we have the second, the runner up. The first two prize winners are Atarf Iyer and Kanishka Manikandan. And then the runner-up with them would be Ridhani Kathimbari. Congratulations, all of you. You have done a great job with those videos, and keep it up. And we're happy that if we can promote awareness in 5 and 10 years old, we expect a very good generation to come. Moving on, Dr. Kavita, my question to you uh, is is the usage of antibiotics, is that the only reason, or is that the only way where antibiotic resistance develops? Or as a microbiologist, has it got to do with the environment and the community that the bugs are getting mutated and not responding to the medications? So is it both ways, or is it just pure negligence from the doctors?
It is not only from the doctor perspective, it is in the environment also. Environment also means in the other, like if you see the poultry and vegetables. So these days in the industries, they are also using lots of antibiotics to keep their animals healthy and their whatever vegetables grown healthy. So there they also use the antibiotics. So these organism gets mutate there also. They change their forms there also. And when we get these infections from the animals or these plants and in these, so then we get that mutated organisms in ourselves. So that also creates a problem to us. Like salmonella is a common example which causes the diarrhea and all, and it commonly comes from the animals like chicken, poultry, and all these. if that is not cooked properly and patient acquire the infection from that, so at that resistance organism, so that can also create the problem. So only not on the human antibiotics, but animal antibiotics are also injudicious use of that also is causing the most resistance in the organisms.
So in a way, we are also responsible because we have been purchasing products, or the industries are now selling products which are modified genetically, or they have been given antibiotics, and then that food reaches to our stomach, and then that creates another effect on on these microbes. So I think you're
Yeah.
right. We have to be careful. Dr. Kavita, what is the prevalence of in Dubai of this antibiotic resistance? Do you have a data? Is there a study? Do you have a number?
Yeah. So first of all, how we come to know this data, like what is the prevalence? Maybe people read in the newspapers also antibiotic resistance is increasing. So how we get this data? So whatever culture samples, like Dr. Samay mentioned, we get in the in the lab for the testing. So in the first quarter of the year, for the previous year, we accumulate that data, like what all organism we have isolated in that particular year from what that sample, and what was the antibiotic susceptibility for that or particular organism. So we compile that data and do the cumulative analysis and compare it with the previous year's result. Send this data, then we send it to the UAE National Antimicrobial Surveillance 2 also. And this UAE also goes further to the WHO. So every level, scientists study about this, that how much resistance is increasing every year. So in the last 2 3 years, or maybe 10, if you go back in 10 years, for the certain antibiotics, we have seen a huge increase in the antibiotic resistance. In UAE, it's not very high, but it's alarming stage. So we need to start working and making people aware, doctors, patients, everyone, that antibiotics should be used judicially.
Okay, but I'm just curious. If the doctors have stopped, if the doctors have started prescribing antibiotics without doing specific tests or cultures like Dr. Same mentioned. So if we were 100 doctors in a community and we prescribed antibiotics without doing cultures, how would that impact your results? Because now I'm not even doing the culture. So how do you know that you compare these numbers to next year's and they will be the same, or we have created a resistance? Is it purely based also on clinical examinations? For example, a patient comes to the physician and he doesn't respond to the medications. Is that also one of the ways where you gauge it?
It's work on probability factor. Like whenever patient gets the urinary infection, it's most commonly, like we found that from data. Like it most commonly last year it was from the E. coli. That is the name of one organism. Second organism is Klebsiella pneumoniae. Third, so we make a list of the organism. So once patients comes, so that there will be a 60 to 70% chances that patient will be having the infection with this organism only. So, on the basis of our last year analysis, we suggest the doctor, if you cannot wait for the culture report, you should start with this basic type of drug, because this organism in our last year data is sensitive to that drug. And in most of the cases, that patient should respond to the antibiotics. But if patient is not responding, again having the symptoms are persisting or deteriorating, then patient should come to again to the doctor and correlate with their culture report, because culture reports usually take 2 days to come. So then they can
Right.
see and compare whether that whatever drug has been given, that is patient is the organism is sensitive to that or not. So whether continue to that same antibiotic or needs to change the antibiotic. So in that way we
Absolutely.
work.
Absolutely. Thank you. Dr. Mary, are the bugs in a normal young adult female? I'll compare it with a female since you are a gynecologist. So, a young adult female patient who has a bug or she has some microbes, is it the same type of infection in pregnancy, or are they different? Because then it becomes a bit tricky to treat them.
When the bugs may be the same, but the situation is different. Like over here, we have during pregnancy, basically, the what we advise our patients is try to prevent an infection as much as possible. Like prevention is better than cure and much cheaper. So they would try. We would advise them from the first visit itself that you are not sick, you are pregnant. But at the same time, there are a lot of things that we can do for you, and there are so many things we cannot do for you. So be careful about certain situations, and don't get yourself into a situation where you could land up with requirements of medication which we cannot prescribe, because it is going to affect both you and your baby to be, and we would like to prevent such a scenario. So as the patient comes into the clinic itself from the first visit, like when they come for their pregnancy test and it tests positive, we sit them down and give them a good general talk so that they understand the situation, the do's, the don'ts, what they can do, how much they can go, and what is our limitations in treating them, especially when it comes to infections. The most common ones that we see in the first trimester would be where the restrictions are much higher because of the organogenesis that is occurring in the baby, is the urinary tract infection and the candidiasis and things like that. Now, this is the same sort of infection that you could see in a non-pregnant woman, but when it comes to pregnancy, the situation is little different because our limitations are there, and the choice of antibiotics are also limited, because there are some antibiotics which can cause effects on the baby, the newborn baby, which we do not want to happen,
Excuse me.
it be the first trimester, second, or the third trimester. Because these and some antibiotics which we can give to a non-pregnant woman, we cannot give in a pregnant woman. For example, like tetracyclines, we cannot give it in a pregnant woman. We have to classify the patient as pregnant or non-pregnant. Even whether
Interesting.
it comes to candidiasis, also canesten, like clotrimazole is okay, but we cannot give diflucan. So many things are there. There are certain drugs that we cannot allow in pregnancy, and we need to keep away from them.
Excuse me. Sorry. Right. Interesting. Thank you. Thank you, Dr. Mary. Dr. Tanmay, what about children? Same type of bugs, different bugs, and how quick are you to prescribe antibiotics? Change.
He's on mute.
Dr. Tanmay, we can't hear you.
Hello, can you hear me now?
Yes.
Yeah. So as I mentioned to you earlier, the vast majority of the infections that we see in children are respiratory infections and gastrointestinal infections. And I would say respiratory are the vast majority. And not, as you mentioned, I think one of the other doctors also mentioned that not every cough cold that comes to us is necessarily bacterial and would be needing an antibiotic. So how do we make a decision? The decision, first of all, primarily of any treatment is based upon the clinical examination. So, coupled with the history of the fever, whether there is fever or no fever, how long the fever has been, and along with how severe the symptoms have been, what is the age of the child? For example, a child who is an infant or a child who is less than 6 months old is more vulnerable to pneumonia and otitis media and complications of respiratory infections. So we put all these things in mind. We would also look at the clinical examination. For example, if there is obvious pus formation on the tonsil, there's obviously yellow mucus which is seen, which indicates pus formation around the back of the throat, anything like that, then of course we would start an antibiotic even on clinical grounds. At the same time, we would take a throat swab culture, especially to rule out streptococcus, because that would require a little longer period of treatment. Having said this, if there is no obvious clinical signs of suppuration or pus formation anywhere either in the nose or in the throat or in the eardrums, or there is not much congestion in the chest, we would hold on to an antibiotic. And if the child does not respond to symptomatic treatment like cough medicines with or without nebulizer medicines and antipyretics, then we would do further lab tests like Dr. Sami mentioned, the complete blood count, the C-reactive protein, and in children we would also do mycoplasma to see if there is any presence of any bacterial infection that requires treatment. And then based on that, we would decide on the course of action further. Doc, we're not able to hear you.
You are mute, Dr. Hamid.
Can you hear me now?
Yeah, we can hear you now. Yeah.
Excuse me, my apologies. Dr. Same, my question for you. We see a lot of different population in Dubai or in UAE. Is there any difference in the types of bugs that would present in a society if you had different types of populations? Would it matter for you to treat?
Definitely, it's a very good question, and I thank you for asking this question. Definitely, patient profile, as I mentioned earlier, decide or it will direct me to the culprit bacteria or virus. For example, I will give very common example. If we have Indian patient coming from recently India less than 5 days, and have fever, and he came from area where he have a lot of mosquito and stagnant water there, so I have to highly suspect, for example, in rainy seasons, malaria, chikungunya, some types of what we call it hemorrhagic fevers. If a patient coming from Africa and but he's staying here for more than 1 year without any history of travel, so I should not be suspicious that he's having malaria. For example, uh, if any patient came from recently just came from a long flight and he came from area with high COVID status and low vaccination status, I have to suspect that. So the patient profile and history is 50% of diagnosis here. You have to search properly and thoroughly in history the patient age and exposure and job. For example, if you are working as airport officer, you're exposed to a lot of bacteria and working in the public. It's different from I'm treating housewife. So that the nationality is different, the travel history is different, the exposure is a difference, plus the clinical symptom, the patient coming to me is different. So different nationalities would affect, especially with travel history. Some nationalities are affected with more diseases common in their home country, and he came recently from his visit. And Dubai, we have near 90% expats, and we just came out, يعني from what we call it holiday seasons. If, for example, patient coming from Europe or coming from India, coming from Egypt or Pakistan or Australia, definitely there is some microorganisms or bacteria more common and more prevalent in this area. So again, history and proper identification of risk factor, it will affect how we can deal with this and how we can categorize those patients. And that's why in some situation, for example, if we remember Ebola when hit Africa, there was a circular from the WHO. Anyone coming from Africa with a fever should be quarantined until ruling out Ebola. Because this is a simple, rapid example of the importance of travel history and nationality. This, I think, would be a rapid answer for your question.
Great.
Dr. Hamal, may I make a point here?
Please,
Dr.
please,
Hamal?
Dr. Tanmay,
Yeah.
please.
Yeah, I completely and wholeheartedly agree with what Dr. Same said. In children, this happens even more because children, as you know, they have school vacations, and then when they go back home and then they come back, they bring back all the possible diseases from there. And in countries where sanitation is an issue, or hygiene is an issue, or where there's overpopulation, overcrowding, we see a lot of children who come back with bacterial gastroenteritis, with amoebic dysentery, with salmonellosis or typhoid fever. Children, as Dr. Same said, we see children with malaria, dengue fever, and things like that. And uh, the other thing is that the population of community germs or community acquired infection, the etiology of community acquired infections is necessarily geographically different because the climate is different, the seasons are different, and the population, the how would I say, the size of the population is also different. That being the case, for us doctors in Dubai, it's a very unique situation because, as Dr. Same rightly said, more than 90% of the residents in Dubai are expats. So keeping in mind all the and juggling around the diagnosis of all the possible diagnoses that the of the infections that children could bring from all these countries becomes all the more important for us to consider, especially when children are coming back from their holidays.
Actually, I can add one more thing in this one.
Please.
Uh, all the bacteria microbiologically we divide into the gram positive and gram negative. So if we see the globally, gram negative resistance is more in the Asian and developed countries, while in the Western setup it is more for the gram positive organism like MRSA, methicillin resistant staphylococcus. It is one type of organism. So we see more of resistance in the Western patients. This type of resistance. So
Why is
that
it so,
also.
Dr. Kavita? Why is this? What is the reason for this?
In the developed countries, mostly antibiotics are available over the counter, and pharmacists are prescribing the antibiotics. So there is very much injudicious use of the antibiotics is there. So and gram negatives are the mostly cause the infections. If we see the ratio of infection by the gram positive and gram negative, so gram negative are higher. So they are more exposed to the antibiotics. So that's why more resistance is developing them in the developed countries.
Interesting. Thank you. Dr. Kavita, what are you, as a chair of the antibiotic stewardship program in Prime Care Group, and even otherwise as a microbiologist, what steps do you expect us as laymen, as the community, do you want us to take in order to improve and help you in in this endeavor of yours?
From the community perspective, the only thing, don't ask your doctor to prescribe antibiotics. They are educated well, they know when to prescribe. If they are prescribing, take your antibiotics properly in the complete dose, whatever is prescribed by the doctor. So that is very important for the community to understand, because putting pressure on the antibiotics, prescribing antibiotics that they cannot come again for the culture report, they cannot wait for the culture report, that sometimes doctors get in dilemma that what should I do, whether I should give the antibiotic or not. So that undue pressure community should stop giving to the doctor. So that will help us.
Great. I hope that all our listeners are paying attention to this point, that we should reduce the demand of antibiotics and let the physicians decide this. I'll move quickly to the winners of my poster competition. It's a category of 11 to 15 years old. We have more winners here. We have a tie on the third spot, but we have a first prize, excuse me, and second prize. The first prize goes to Batul Mufaddal. Second prize is, excuse me, Jamie Feliz. Third prize on the sharing spot is Adi Binu Bhaskar and Bhakti Venkateshagde. Congratulations to all these teenagers. They have done phenomenally well. They have created very interesting posters and a lot of thought process. And we are so happy that you are part of this campaign and program. Dr. Mary, moving on to you again. Pregnancy and the state of pregnancy is quite strenuous and it's quite difficult for a female. Now, on top of that, if she gets sick and she gets unwell and she has to be given antibiotics, are there any risk of higher side effects in pregnant women than in a normal female? Because physiologically now things have changed. So, how do you manage those as a gynecologist?
Yeah. Like I said earlier, I immediate as soon as they diagnose themselves to be pregnant, I first give them a little talk about how prevention can be done and how it can be carried out, so that we don't land up in a situation where we need to involve the inclusion of antibiotics in their treatment. What I would like to tell them is the easiest way out through pregnancy is what is to be taken, rather than trying to challenge it along the way. Like, for example, going to the beach without, proper headgear or proper whatever from the draft of breeze, or not drinking enough of water, or not, passing urine frequently for UTI. So such sort of small nuggets of information, I give it to them so that they can follow them and prevent themselves from getting any infection. So first thing is prevention. And then of course I will tell them also the difficulties that we have when we have to prescribe antibiotics. It cannot be done like how I would do it when a person is not pregnant. Like in the first trimester, for example, for pregnancy, I divide them into trimesters. The first trimester I say is the first, say, 13 weeks of pregnancy, and I tell them that is the time when the organs of the baby are getting formed: the eyes, the nose, the mouth, the lips, the heart. And they need to be careful that we also need to be careful that we are not prescribing anything that would cause any harm to this developing fetus, because that's the most important time, the organogenesis time. But in case she has a situation where she needs something, like, it's a very bad cough or it's a very bad urinary tract infection, then of course there are
Dr. Mary,
options to. Yes.
sorry to interrupt you, but because it was this moment, I had to ask you this question. Dr. Mary, during the pregnancy phase of a female patient, is there any phase which is more she's more likely to get an infection? Do these pregnant women have to be more watchful during a certain phase of their pregnancy?
There is nothing like that. Pregnancy carries on beautifully without any problems if they are careful and they take all the preventive measures. There need not be any interference, any problem, unless there are situations like the patient is diabetic, or she's gone into gestational diabetes, and then there is a situation where the urinary tract infection comes in more repeatedly, or there is candidiasis that is coming in more repeatedly, or situations like that. But prevention is what I would tell them as a first standard. And second thing is, if they do get sick, then sometimes we have a choice of antibiotics that we would use. We would go more in favor of penicillins rather and cephalosporins, rather than trying to give them any other brands which can cause trouble for them, like gentamicin, kanamycin, streptomycin. These things are not allowed because they cause ear problems. The tetracyclines cause discoloration of the teeth. Then the quinolines, they cause cartilage damage to the long joints, and a lot of different things like this are there. So therefore we do not want to cause any sort of problems in a developing fetus. Of course, in a situation like this, the mother is important to us, and we would try to do anything in our capacity to help her to go out of that situation that she is in. The first choice would be something that is like probiotics. Try to see different measures that would help her out. If nothing's helping and the situation is not getting better, then of course we will move on to antibiotics, which definitely help. But ask them to take it as the shortest period of time, the best time, and make sure that she completes a course so that she doesn't get resistance to those antibiotics and then they are lost, because our choice of antibiotics is quite limited in pregnancy.
Dr. Tanmay, my question for you. You must have noticed, of course, in your practice and around you as well. I have noticed that myself, amongst my own friends, among people that I've known, that they start a course of antibiotics, they give their children 2 or 3 doses or for a couple of days, and then when they see the child getting better or the fever stops, they stop giving the antibiotics. What do you say about those cases?
Well, see, the duration of antibiotic treatment in all clinical conditions is based upon decades of data which has been pooled from various researches. And then a solid clinical database is created from which it is conclusively decided that in a specific kind of infection, this is the duration of treatment that is required for complete eradication of the organism which is causing the infection. Whether it's a throat infection, a ear infection, a urinary infection, gastrointestinal, or a skin infection. So, in all these cases, when doctors prescribe antibiotics, they're given keeping in mind these international guidelines. And these international guidelines have a very strong foundation of research which has been there going on for more than, I think, almost maybe half a century. So that is why it is not a good idea for any parent to stop the antibiotic halfway. The antibiotic, there are three things in an antibiotic. Number one, the dosage, number two, the frequency, and number three, the duration. All these three things are extremely important for the parent to understand when they pick up these medicines at the pharmacy, and equally important to see that the child is compliant with taking all these doses. I just want to share, something on the lighter side from my clinical practice here is that I've been in practice now since about 35 years, and I've seen several different generations of children. And the thing which I see in today's generation of children, many of them, I won't say all of them, but many of them, is that they fuss a lot about medicines in general. And when it comes to antibiotics, especially, they tend to be very fussy. And most of today's parents are unable to handle it. I think it's important for all parents to inculcate this notion in children, is that antibiotics are not something for them to enjoy, nor are any other medicines. They're medicines. They're to be taken because the child is ill, and they need to be taken because the child needs to get better. So very often the parents stop the antibiotic not just because the child is better, but because they're so frustrated with the child's compliance that they just want to take the easy way out and stop it. You know. So I would all advise all parents that please teach your children that medicines are not meant as something to be, they're not for their entertainment, it's not for their enjoyment. And they have to bear a little inconvenience, even if the taste is bitter, even if the smell is not that good. They should complete the course, because that is the only way you can make sure that the infection is completely gone, and it also avoids the development of antibiotic resistance.
Right, thank you. Dr. Same, I have a question for you. Uh, we try as physicians, you prescribe antibiotics, you prescribe the one with the least complications, side effects. But how common are these side effects? Are there any specific common side effects? And what about the allergies? So if you gave a patient a set of antibiotics and he did not respond, or he started having an allergic reaction, how would you decide to choose the next one? On what basis? And how would you know that he would not have a reaction to this one as an internist?
First of all, before I prescribe any antibiotic, I watch my screen here if you have any allergy documented in our prime system. First of all. Second, I ask the patient if you have any previous allergy from any specific substance or medication. Third, I advise patient, and this is my daily practice with every patient, do not stop antibiotic unless you have a significant symptom like rash or allergy or anything like this. And at that time, he have already my contact number, and he contact me, and I respond to him instantly to give him the proper advice, and he should come back to me. This first. And I tell him, I emphasize about the fact that you should not stop the antibiotic whenever he feel improved. Even after 2, 3, 5 days, you should complete the prescribed duration to avoid future resistance. This is regarding the prescription. If you have allergy for a specific class, for example, penicillin, there is a cross allergy or a similar allergy with a different, a near class like cephalosporins. So I would be more cautious to prescribe any medication, antibiotic about similar family. So usually I go to a different class, a different alternative, and at the same time following the medical guidelines or the antibiotic map, or what we call it antibiogram, which help the treatment of that bug. But first of all, I highly advise all my colleagues, and I advise myself first, and I remind myself first, do not ever prescribe any antibiotic before asking about history of allergy, and watch the allergy, what we call it, alarm in our system. This is regarding the oral form. But if we have, for example, I need to give him something through the vein. Here, usually, I never prescribe any antibiotic without a measures counteracting any severe allergy. I do skin testing for specific types of antibiotic. I do it with proper monitoring. And this is a work code. We do it here, at least in our medical facility, to make sure that there is no hazardous side effect affecting the patient if he take the antibiotic through the vein. This is regarding. I would like to mention some point about what Dr. Kavida and Dr. Tanmay and Dr. Mary they give a very precious advices regarding the antibiotic, and I'm sure they heard about this. Uh, Here in UAE, one of the few countries in the Middle East that they have very strict, what we call a control over antibiotic, and I'm very happy about that. That there is no patient can take antibiotic from the pharmacy as if he's getting to buy any gummies. No, he should have a prescription signed and stamped by a registered physician. And this is a very good thing here in UAE. And I highly embrace it. And this actually is reflected in some countries in Europe. For example, in Sweden, Norway, Scandinavian, the first world country, you cannot get even simple antibiotic amoxicillin without a medical prescription. And that's reflected on the population there. They have a very good sensitivity to the antibiotic due to prevention of any abuse or non-authorized use or over-the-counter use of antibiotic. That's why those people there, they respond to very simple antibiotic, and they do not get, they don't need to get a big guns of antibiotic that we need here in some countries in the Middle East, for example, due to non-judicial use of antibiotic. So this is would be answer for your question regarding the allergy. You should watch out the history. You should ask the patient, and you should watch your documentation in our system. Third, if you have alternative, don't give alternative of similar family. If you give it through the vein, you should be alert for any systemic hazardous side effect. So you have to be prepared to the worst scenario and any medication given through the IV. And I'm here emphasizing about this fact because we all heard about some very harsh allergy types, especially when we took the antibiotic through the vein without a proper medical supervision of any undesired consequences.
Great. This is precisely why we have created this webinar today, which is why we have Dr. Kavita on board with us as a chair of this committee, because the purpose is to reduce the intake of antibiotics, if not required. Of course, that's the only point. We will be about to close. Just we are reaching to the end of this program. I just would like to ask one last question, Dr. Kavita. This is a question about good antibiotics. I mean, layman calls it a good antibiotic, or I think probiotic is what they mean as a question. So what are good antibiotics or probiotics, and how can they help if you take medicines and you try to eradicate or you try to kill a set of bugs in your body? Then what is the concept of giving you this other set of antibiotics, good antibiotics? Would you like to just quickly tell us about this? Sure.
Yeah. Actually, probiotics are not the antibiotics. This is a mixture of bacteria. So what happens when doctor prescribes any antibiotic to the patient? So it affects the normal gut flora also. So that normal gut flora helps us to maintain our GI system properly. So if we take the antibiotic, this gut flora will get die. So that's why you take this gut flora organism as a supplement, and that is called as the probiotics. So it helps like after the antibiotic side effects reduces that can cause like diarrhea and all. So but probiotics use reduces the diarrhea. So that's where that is given along with the certain antibiotics, not with the all antibiotics.
Right. So that is the nature's way of telling us that don't use antibiotics. God has given us already some antibiotic, some bugs in the tummy to help us.
Yes. Yeah.
Good. Dr. Mary, probiotics, safe to use in pregnancies?
It's okay, it is allowed. Now, I have a special concern here There are certain patients who go over the counter and buy things, for vaginal washes and vaginal douches and things like that. And in the process, they lose the Dodalins bacilli, which maintain the pH in the vagina, which prevent them from getting infections of different varieties. Because pathogens are available or present in the vagina per se, but the Dodalins bacilli maintain a acidic pH and prevent them from proliferating there. So these injudicious use of these douches and things that are available over the counter, I advise my patients to avoid such things. Now, the use of probiotics do help because they help recolonize the gut and also recolonize the vagina with the helpful bacteria, which is going to prevent infections from coming and taking over. So I do advise them, especially when there is a gut infection or even if it's a urinary tract infection, and they have come with symptoms which are very typical of a urinary tract infection. I do give them sometimes one single dose of Monural or fosfomycin, and but Monural is known to cause some loose motions for maybe on the next day. So I advise them to just go in for maybe an active yogurt or something the next day, which would help to get back their lactobacillus and would sort out that problem of loose motions on the next day. Because some situations we have to give some antibiotic which would be useful and prevent further infections which will proceed into sepsis or any other deleterious effects, and therefore we need to use them when we need to use them, but not otherwise. So
Fair
sometimes
enough.
probiotics do the trick, sometimes we have to go in for antibiotics, both
Of
ways.
course, of course, rightly said, Doc. Moving quickly to Dr. Tanmay. Any thoughts on prebiotics in children, Doc?
Yeah. Just want to make a couple of points here. First thing is that all parents should understand what is the difference between prebiotics and probiotics. Probiotics, as Dr. Kavita rightly said, are basically friendly bacteria which are present normally and naturally in our intestines, in the respiratory system, as lining of our respiratory systems, as well as on the skin. And the predominant population is in our gastrointestinal or our digestive system, and they help to not only maintain the gut immunity but also overall the immunity of the human body. And the prebiotics are a certain form of carbohydrates that encourage the growth of these probiotic bacteria. Now, these are naturally present in the human breast milk, and there are many interesting studies which show that if the mother breastfeeds her baby and exclusively breastfeeds the baby in the first 6 months of life, then the probiotics that naturally develop inside the gut, or the microbiome that develops inside the gut, helps to prevent these babies from developing all kinds of infections as compared with those children who are formula fed. So I would say that breastfeeding exclusively for a period of around 6 months and thereafter continuing breastfeeding until the age of 2 years along with solids is is nature's way of protecting children by encouraging the formation of good probiotics naturally inside the gut and protecting them from infections. This is one thing. And the second thing is that, unfortunately, here, I mean, I just want to point out one thing is that I'm from India. And in India, all over India, yogurt is cultured by households in each individual household. And that cultured yogurt contains a rich amount of your probiotic bacteria. Dubai, unfortunately, the system of culturing yogurt in every household is not there. But we do get what we call probiotic rich or active forms of yogurt and laban and these kind of things. And if certain communities I have also seen here who are culturing yogurt at home. So these are simple ways in which you can give not necessarily these medicinal probiotics, but what is commercially available probiotics can be given on a regular basis to children to protect them from infections. So yes, probiotics do have a major role to play in the protection of children from infections.
Thank you. Again, thank you very much. That was a great answer. Your response again is pointing out at nature doing what it does at best, So going back to these remedies and helping and incorporating them in our diets, I think it would be better than going and buying over-the-counter medications. I would just like to announce my winners of the essay competition. Last two children between the 16 and 18 years. The first prize goes to Nia Maria Saji, and the second prize is Anna Rose Sebastian. They had written some great essays, and it was very well written. It was very interesting to read how these children think about the antibiotics in society. I would like to thank again Prime Healthcare Group, Prime Digital, Prime Hospital, all the clinic heads, all the administrators, all our teams, especially today the topic is antibiotics. So I would also thank again all our diagnostic center staff and laboratory staff that have played a crucial role in providing us with results where our physicians are capable of diagnosing and providing medications to the patients. Once
Dr.
again,
Mohammed, Dr. Mohammed,
yes,
just one point I'd like to make, one request I would like to make is that
please,
you announced
please.
a lot of winners in this during the course of this webinar. It would be nice if there is a platform either on Facebook or any other social media platform to display all the paintings and the posters as well as the essays which are written,
Absolutely.
which will
Absolutely. We
might
are
appreciate
we
a good number of people.
that is a great idea, and we actually wanted our viewers and all our Prime loyalty patients and their families to actually see what these people have done who've won today. So the Prime Digital team is actually working on that, and in the next couple of days or a week, I think they'll be putting it on all their social media, on their platforms. So again, it would be a good chance to see how much the society, the community, especially the young generation, is involved in this. I wholeheartedly would like to thank each and every one of you for joining us today. Again, starting with Dr. Kavita Didi, who's been a very major support, playing the major role in being the microbiologist, dealing with all the bugs and all these results. Dr. Mary Zakaria, thank you very much for joining us today and being part of this campaign with us from a gynecologist perspective. Dr. Tanmay Radhakrishna, thank you for all these, for all your comments and your advices and the information that you provided with all your vast experience. We are happy to have you. And I'm sure that all these children are now in safe hands, having physicians like you. And last but not the least, Dr. Samir, an excellent physician with a very, very good mindset, evidence-based practice. We are happy, we're very proud. Prime takes pride in this, that we have a team of physicians who are very diligent with their work, and we give our best to the society. So I would like to thank everyone today on this panel for being a part of this, and I wish everyone to be safe and also to be very careful with antibiotics use. Thank you, everyone, once again.
Thank you.
Thank you.
Thank you,
Thank
Doctor.
you. Thank you, viewers also.
Thank you.